Hi, everybody. This is Norm Dubay with the Copa Roundup. That's right. It is Friday, April 1st. It is April Fool's Day. I know so many people like to joke around and pull pranks on April Fool's Day. But today we are lucky enough to once again have Jodie Gonzalez, who is a Copa Health mental health counselor, with us, and we're talking about a serious subject. But before we get started, Jodie, how are you doing today?
I am great. Busy, 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 but I'm doing wonderful. Yeah,
Well, it's
glad to
good
be
to
here.
see you. Yeah, I'm so glad that you're here. It's good to see you now that spring has sprung and we're moving into the nice weather for the next month or so before we start really getting the heat. But I'm so glad that you were able to join us. So Jodie, as as I mentioned earlier, you are a mental health counselor, and I know that you deal with some specific things. But one of the things that we're talking about this month, and I make a joke about April Fool's Day, but this is no joke. April is Alcohol Awareness Month for abuse and misuse. I think you mentioned to me earlier. Can you tell us a little bit as a counselor why it's important to focus on alcohol awareness, all the time, but especially in April?
Yeah, well, so it is abuse and misuse. But really it is just alcohol awareness. So it's really about education. So alcohol is important because it does shed light on the cause and effects of any kind of alcohol related outcomes, right? So of overuse, abuse, alcohol consumption can increase so many different medical concerns. It has a risk of chronic diseases such as liver disease, brain injury, cancer, heart disease, even extensive effects on several different other cancers. So like all cancers. It even has several different effects on mental illness. Okay, so mental illness, it increases stuff with, well, we all know what the symptoms of increased mental illness and what those can cause on health concerns as it is. So, but when we look at alcohol awareness, that also increases the risk of cardiovascular and digestive systems and respiratory conditions. So we really want to take a look at that. It does put individuals at risk of developing even mental and behavioral disorders. So when they previously didn't even exist before. Okay, so we look at alcohol and we look at the consumption of alcohol. Alcohol is a mind-altering substance. Okay, even though it's legal, it's mind-altering. So that can increase different behavioral issues, which of course can cause concerns for increased symptoms of mental health. It can cause concerns of well, I say increased stress, and I can get to that in a little while, but increased stress, if we know anything, increases mental health symptoms. So when we talk about increased mental health, alcohol is a huge factor to be educated on and to understand the impact of vulnerability, right? That it has. So
Yeah, so Jody, when we're talking about alcohol or abuse or misuse of alcohol, either causing or affecting mental health, I imagine it's also used as a something to cover up mental health issues that whether it's anxiety or depression or other mental health issues too.
absolutely, absolutely it is. So when we look at the effects of alcohol, okay, so yes, 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 and yes to that answer. Okay. So I want to just share a few numbers. So in 2019, the National Institute of Alcohol Abuse and Alcoholism surveyed that 25.8% of people that were 12 and older were binge drinkers. Okay, 14.5 million people aged 12 and older had an AUD, which is an alcohol use disorder. And there were 95,000 alcohol-related deaths. Okay, so there's two aspects to this that I want to kind of discuss. So since COVID, the prevalence has a fourfold in mental health. So a fourfold with increased depression and anxiety. Okay, so when you look at, the isolation, that's happened, masking, all the fear that it's put in individuals to go out and be around people, we're isolating. So yeah, we're drinking, we're trying to cover all those symptoms, just trying to make some kind of normalcy in our life. Absolutely. So alcohol is a neurotoxin. It interferes with communication pathways in the brain. Okay, so it affects the way our brain works. It alters mood and behavior, and even physical coordination. So, and bear with me, because I'll get to that mental health piece. Okay, so it does interfere with social and environmental, physical, behavioral relationships, even spiritual factors. And I tell you that because that's very important, because when we are trying to stabilize an individual in any sense of the matter, mental health, alcohol, anything, it's really about creating some kind of balance. Okay. And so when we have increased stress, like I said earlier, when we have increased stress, we have increased mental health symptoms. And when we have increased mental health symptoms and we're isolating, we have to find a way to deal with that. Okay. And so then, of course, we drink more. Right. And we drink more to cover the symptoms, not completely being aware of all the physical factors that could be happening to us. So, excuse me. Okay, so we want to decrease symptoms. However, we want to do this, and we must work toward alleviating any kind of distress that alcohol brings. Okay. We want to be able to create a more balanced lifestyle, like I said. And we want to be able to increase our vulnerability. And please bear with me, because I did write some of this stuff down because it was a lot. I wanted to share the world. Okay.
Well, hey, no, it's a very big subject, and I think that's one of the things that we all talk about, because it is not something that is a small problem in our society. But when you couple it with the potential for a co-occurring mental illness, or a mental health condition, then it gets even bigger.
It is. And trying to wrap everything up into a little 15-minute, 20-minute segment is a lot, because really we do want to educate. We want to educate not just the individuals that are struggling with the AUD, but we want to be able to educate family members and, friends and coworkers and, whoever. We want to make people aware. There's so much stigma out there that we just don't, if somebody's not educated, we take a negative outlook on that, and, we have increased vulnerability really in, all areas. So we want to be able to restore a meaningful lifestyle, right? And so when we look at the mental health field for treatment, we want to, we look at mental health and we want to say, okay, like, well, how do we treat this? And we want to look at it as a co-occurring disorder. So we can't just treat the substance use, and we can't just treat, not substance use, the alcohol use. We can't just treat the alcohol. We have to treat mental health as well. And we have to find a way to restore that balance. Okay. And so we want to bring people in, and we want to talk to them and educate them. We want to educate them on the programs that we have. And we want to, not just Copa. Copa has great stuff. We have IDDT, our IDDT dual diagnosis program, which is wonderful. I ran it for 5 years, and it's an amazing program. It even taught me a lot. But we also want to look at some of those other factors, counseling and medication management, and relapse prevention programs, maybe even, finding sponsorship and 12-step programs, PHP programs at times, depending on the intensity of it, right? There's a lot. And sometimes even going as far as like, not even just so much treating the alcohol, but treating some of those other factors like codependency and relationships, referring out to places like CODA, to try to kind of start working on some of the codependency and learning how to build healthy relationships, because a lot of times those are the things that we kind of let go of and we lose sight of when we're using alcohol. And so being able to educate on all the losses that we've had behind our alcohol use, it allows us to be able to start teaching an individual how to incorporating those things back in their life so that the alcohol no longer has to exist.
Yeah. Sometimes, Jodie, when I have somebody like you on the Copa Roundup, when we're talking about such a big subject, I feel like I'm walking up to a judge or somebody maybe on the Supreme Court and say, hey, quickly, can you explain the law to me? And it's just not something that can be done quickly. There's just too many factors and too many things that go into it. But so I think you touched on it a little bit, but tell me, so if we have, somebody that we care about, a loved one, family, friend, a colleague, somebody that we really care about, and we think, or we suspect that they might have a problem, or we know that they have a problem, what can we do to try to help them?
First and foremost, educate yourself, right? Educate yourself. I think that's the one thing that I really love about Copa is that we have our family mentors that run the family programs, because I think that that is a huge factor. I think in order for someone to help a loved one or a friend or whoever in their life, they have to be able to understand what it is they're looking at, they're dealing with, right? Excuse me. So educate yourself, not just on the alcohol, but educate yourself on mental health. Understand, what you're working with, understand how to cope with someone, but also support someone. Understand how to keep yourself healthy in the process of trying to help somebody else. I also think that it's important, while you're keeping yourself healthy, it's really important for you to be able to express your own concerns and your feelings. Definitely letting somebody know that, and I say this like a counselor, using I statements, this is how I feel, right? This is how I feel when this happens, or, whatever it is you want to say, but expressing your concerns, being able to express your concerns without it sounding like an accusation. Okay. We want to provide some valuable resources, and we have to give the support that is needed to get somebody started on any kind of treatment options that they are ready to. However, that's kind of the key word, is if they are ready to, right? We want to be able to support individuals at a level that empowers them enough to know that they have a personal value that's worth saving, right? So that they can go and accept the treatment that's being offered to them. But we can never save somebody. So I say that if I have somebody in my life that is a loved one that I am really wanting to save, the best thing I can do is to save myself first. And so we can give all these resources, and we can guide, and we can support. But more than anything, we have to educate, we have to set boundaries, we have to avoid any kind of codependent behaviors toward others, and we have to take care of ourselves. Only by doing that will we be able to be healthy enough to help somebody else when they're ready.
Yeah, I think, one of the biggest things that I see about Copa Health, and thank you for, when you reference that, is that we want to give people the tools that they need to help themselves and to help others. And you are right. I know that obviously everybody, or most people, know about Alcohol Anonymous and Alcoholics Anonymous and Al-Anon, which is for those who are living with somebody who has these. And I'll tell you what, Jodie, I'm going to reach out to you after we get this done today, and I'm going to post some phone numbers at the end, or some websites at the end that people can get to in order to do that, in order to reach out and educate themselves more. Yeah. And when you said you talk like a counselor, I have to admit something. I know you, and I know you are a counselor, so I'm glad you talk like a counselor, because it really makes sense. But Jodie, we'll put some information at the end, but thank you so much for, joining us today.
You are very welcome. I am more than happy to.
Well, I really appreciate it, because I know, in addition to the work that you do here at Copa, that you also volunteer for many things. And I know that you were one of the people that helped out at one of our clinics, and you went out and actually, were vaccinated and helped support that. So I just want to tell you how much I appreciate all that you do and the example that you set. So thank you so much.
You're welcome. I appreciate that. Thank you.
Okay, everybody, that is the Copa Roundup for this week. But before I sign off, I just want to mention one thing. Copa Health, it's April 1st, and this past week we had the Oscars, which everybody knows is a Motion Picture Academy Awards. And the Oscars were on, and we had a really, really huge Copa connection to the Oscars this year. And I want to just make sure that we get a shout out to one of our board members, Brian Kotzer. I know that Shar would like me to mention Brian. His brother, Troy, was in the movie that won Picture of the Year, Coda, which I believe is an acronym for Children of Deaf Adults. And he was one of the feature performers in Coda, and he actually won the Best Supporting Actor Academy Award this week. And so it was just so exciting to see Troy Kotzer, who is a Mesa native and brother of one of our board members, Brian Kotzer, out there winning. And it's just a fabulous it's a fabulous movie. If you get a chance, I think it's on Apple TV right now. Go out and watch it, and you will know that it's worth the $5 or whatever you have to pay in order to watch it. But it was just fantastic. But hey, that is our Copa Roundup for this week. Like I mentioned, next week we are hoping to have on some people from our supported employment program here at Copa Health. Employment is such a big issue in a person's recovery and people dealing with the disabilities or the mental health issues that they have. So we are looking so forward to that. Until then, everybody stay safe. Hope there weren't too many April Fool jokes for everybody today, and that you made it through April 1st. All right, but next week we'll be on to April 8th, and we are heading closer and closer to the summer. So everybody take care until next week. Bye now.